Rectal bleeding. Main causes. Rectal bleeding usually refers to bleeding from the anus, rectum, or colon, all of which are the final portions of the digestive tract. In most cases, bright red blood indicates bleeding in the lower colon or rectum, while darker red blood is a sign of bleeding in the small bowel or upper colon. Very dark or black red blood is often associated with bleeding in the stomach or other organs in the digestive system. Causes. A wide range of health conditions and factors can cause or add to rectal bleeding. Some of the most common causes include hemorrhoids. Hemorrhoids are inflamed anal bleeding blood vessels, and they are extremely common. They can develop on the outside or inside of the anus, appearing as small bumps that occasionally bleed during bowel movements or when wiping. Hemorrhoids, which are also referred to as piles, can impact anyone of any age but are associated with a few risk factors including pregnancy, chronic constipation and straining, chronic diarrhea, straining during bowel movements or sitting on the toilet for too long, obesity, low fiber or unbalanced diet, aging. Hemorrhoids usually respond well to over-the-counter creams and suppositories that contain hydrocortisones. Taking warm baths frequently, eating a high-fiber diet, and using stool softeners can also help reduce the discomfort of hemorrhoids. If initial treatments fail, a doctor may perform minor surgery to remove the hemorrhoids. Fistulas. A fistula occurs when an abnormal opening or pocket develops between two neighboring organs. Fistulas that appear between the anus and rectum or anus and skin can cause a discharge of white fluid and blood. Fistulas are sometimes treated with antibiotics, but they may require surgery if they progress. Fissures. Fissures occur when tissues lining the anus, colon or rectum are torn, resulting in pain and rectal bleeding. Warm baths, a high-fiber diet and stool softeners can all help reduce symptoms of fissures. In severe cases, fissures may require prescription creams or surgery. Diverticulitis. Diverticulitis is when small pockets called diverticula develop on the walls of the colon around a weakness in the organ's muscular layers. These pockets of diverticula are extremely common. Sometimes diverticula can start bleeding, but this bleeding usually stops on its own. Usually, these pockets do not cause symptoms or require treatment unless they become infected, which is when a condition called diverticulitis occurs. Infected and inflamed diverticula are often painful and can cause rectal bleeding, usually a moderate rush of blood that flows for a few seconds. Diverticulitis is treated with antibiotics and, if severe, surgery. Proctitis or colitis. Proctitis occurs when the tissues that make up the rectum become inflamed, often resulting in pain and bleeding. Colitis occurs when the tissues lining the colon become inflamed. A type of colitis called ulcerative colitis can also cause ulcers or open, progressive sores that are prone to bleeding. Treatments of proctitis and colitis vary depending on the causes and range from antibiotics to surgery. Common causes of proctitis and colitis include infection, some conditions that cause digestive problems such as irritable bowel syndrome or IBS, and Crohn's disease, some medications such as blood thinners, radiation or chemotherapy, anal intercourse, reduced blood flow to the colon or rectum, a blockage in the colon or rectum. Gastroenteritis. Bacterial infections can cause inflammation of the colon and stomach, causing diarrhea that may contain mucus and spots of blood. Viral gastroenteritis does not typically cause bloody diarrhea. Treatment for gastroenteritis usually involves fluids, rest, antibiotics or antivirals, depending on the cause. Sexually transmitted infections or STIs. Unprotected sexual intercourse that involves the anal area can spread a wide range of viral and bacterial diseases. This can cause inflammation of the anus and rectum. Inflammation, if it occurs, increase the likelihood of bleeding. Treatment for STIs usually involves either an antibiotic, antiviral or antifungal medication, depending if the cause is bacterial, viral or fungal. Prolapse. Weakened rectal tissues can allow a portion of the rectum to push forward or bulge outside of the anus, usually resulting in pain and almost always bleeding. Prolapse is more common in older adults than in younger people. Some people with this condition may require surgery to correct it. Polyps. Polyps are non-cancerous, abnormal growths. When polyps grow on the lining of the rectum or colon, they can cause irritation, inflammation, and minor bleeding. In many cases, a doctor will remove polyps so they can be tested for signs of cancer and to avoid the risk of them becoming cancerous. Colon or rectal cancer. Cancer that impacts the colon or rectum can cause irritation, inflammation, and bleeding. As many as 48% of people with colorectal cancer have experienced rectal bleeding. Colon cancer is a very common form of cancer and tends to progress slowly, so it is often treatable if caught early. Rectal cancer, while far rarer than colon cancer, is also usually curable if detected and treated in time. Some cases of colon and rectal cancer develop from initially benign polyps. All cases of gastrointestinal cancer require treatment, which usually involves a combination of chemotherapy, radiation therapy, and surgery. Internal bleeding. Major injury to any of the gastrointestinal organs can result in internal bleeding that passes through the rectum. Severe gastrointestinal disease can also lead to internal bleeding. Internal bleeding almost always requires hospitalization and surgery. When to see a doctor. Occasional minor to mild rectal bleeding is extremely common and will often not need medical attention or treatment. Severe, chronic or painful rectal bleeding may be a sign of a more serious underlying condition and should be assessed by a doctor. People normally notice rectal bleeding when they see streaks or drips of blood in their stool, the toilet bowl, or when wiping. Some people might also find blood in their underwear, or the toilet water may appear reddish pink after they go to the bathroom. Some cases of rectal bleeding also cause very bad smelling, dark, tarry stool mixed with very dark red to black blood. Reasons to see a doctor for rectal bleeding include bleeding that lasts longer than 2 to 3 weeks, children with bloody stool or rectal bleeding, unexplained weight loss, fatigue or weakness as well, painful swollen or tender abdomen, accompanying fever, simultaneous lumps in the abdomen, stool that is thinner, longer or softer than normal for 3 weeks or more, accompanying nausea or vomiting, accompanying long-term constipation or changes in bowel habits, associated uncontrolled leakage from the anus. Reasons to seek emergency care for rectal bleeding include vomiting or coughing up blood, blood running from the nose, eyes or ears, bleeding that is very dark red or black. The reason of bloody diarrhea is unclear, such as unrelated to an abdominal condition or medical treatment, loss of consciousness or confusion, extreme abdominal or lower back pain.